You're ready to go?
Well, we at least need it.
Okay. All right, the chair lays out Senate Bill 485 and recognizes Senator Johnson to explain the bill.
Thank you, Mr. Chairman and members. Previously in this committee, we passed the Supportive Palliative Care Awareness Day. That's not what this one is. This is a bill to designate the second Saturday in October as Hospice and Palliative Care Awareness Day. Not supportive palliative care. We went to some lengths to explain the distinction in the past, but it's important, all the more important than that we have a day to recognize the importance of palliative and hospice care as a separate medical category, but related. These types of care have many similarities. Bringing awareness to their differences is important for ensuring that patients and their families receive adequate information to explore their care options and to support their decision-making processes when dealing serious awareness. Senate Bill 485 would designate a Hospice and Palliative Care Awareness Day, not coincidentally, but intentionally on the second Saturday in October, which aligns with the World Hospice and Palliative Care Day to raise awareness of these two distinct types of care and to honor the workers who support seriously ill patients and their families. Thank you, Mr. Chairman and members.
Members, any questions? Okay, we'll now open up for public testimony, and the chair calls Joni Smith. If you would, tell us your name, who you represent, your position on the bill, and you have 2 minutes.
Thank you, Chairman. My name is Joni Smith, and I'm the Vice President and Clinical Director of Amity Hospice. I'm also on the Board of Directors for the Texas Association of Hospice and Home Health in the state of Texas. I am here today representing myself and on behalf of the Texas Association to testify in support of the bill. SB 485 designates the second Saturday in October as Hospice and Palliative Care Day. We wish to thank Senator Johnson for filing this legislation, recognize the importance of hospice and palliative care and how these services improve and enhance quality of life for those terminally ill and how these services support their families. Recognizing this day, CARE brings awareness to the purpose of the services and recognizes all the caregivers across the state. I would like to take a moment to share the impact of hospice and palliative care in our community for those that are faced with life-limiting illnesses. These services provide wherever the patient calls home to provide them with registered nurses, licensed vocational nurses, social workers, chaplains, volunteers, certified nursing assistants, and people in our community. These services are not just provided to the patient, they are also provided to the family for up to 13 months after their loved ones have died. The impact of care provided not just to the patient, but to those that have to live on is long-lasting. In just my agency, we served a young lawyer who lost his battle with pancreatic cancer who had a 5 and 7-year-old while under the care of hospice. Those children, one now in college and one graduating from high school this year, visit our team every year the week of Halloween to thank us for the services we provided to their family. In America, hospice is like a curse word. With increased awareness by designated Hospice and Palliative Care Day, the services provided and the care provided to those most vulnerable can be highlighted, and we can change the way people receive the words from their physicians. It's time for hospice. It is truly an honor to assist our community in the preparation for end of life. Sorry, I have 1 second. It's a beautiful experience. Thank you, Senator Johnson, for recognizing the hard work of the hospice and palliative care community, and please support our bill.
Thank you so much for testifying. I wish the whole Senate could hear that. It was really quite moving. And the good work you do.
Thank you so much.
Anyone else wish to testify on or against Senate Bill 485? Seeing none, testimony is not closed. We'll leave this